My name is Michael Betel, and I'm the president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with mast cell MASH by advocating for access to approved treatments and care. It's been 2 years since we last spoke with our two special guests today, Taus Holtug, CEO and co-founder, and Dr. Katrine Prier Lindvig, CMO and co-founder of Evido Health. And I can't wait to catch up. Your vision, and I did peek at the website again to get this, is to ensure that fewer patients around the world die from cirrhosis, which is fantastic. How is Evido Health making this happen?
Yeah, no, thank you so much
The
for
big
having us,
goal.
Mike. Yes, the big goal, and that's the truth. Yeah, no, we're really excited to be here today and talk to you about LiverPro and the impact that we're trying to make in the field of liver disease. And just recently in January, we published our recent study in the Lancet Gastroenterology and Hepatology, where we developed and validated LiverPro across 6 large cohorts spanning different geographies. And it's a major milestone for us because it demonstrates not only the diagnostic capabilities, but also the prognostics of LiverPro, and not just for detecting significant liver fibrosis, but actually also for predicting clinical and patient outcomes. And in this study, we were very fortunate to work with some leading experts in the field of hepatology, including Neil Guha and Per Chines, Jørgen Schattenberg, and Heiner Wedemeyer, amongst others. So yeah, their contributions has been very invaluable for us and really strengthens the evidence behind LiverPro.
You have a
Yeah,
great team with you, and that's
for sure.
fantastic. All
Yeah.
key opinion leaders globally.
Yes,
Yeah.
definitely.
And Taus,
Mike, would it make sense for us just to give it like LiverPro in a nutshell, just
yeah,
for kind of
I
catching
think
up on
it's
that?
great. Again, 2 years ago, it was a different world in a lot of ways. So
Yeah,
I'd like to hear how, the world changed and has progressed from the work that you guys have done.
yeah. A lot of things have happened, and we're really happy where we are today and what we're offering to the field today because there's a need there, and that's where Evido started, and we're getting closer and closer to actually achieving that. But just to maybe just make a brief intro on LiverPro so everybody knows what we're talking about. I know you know some details, Mike, but in a nutshell, it's a new liver fibrosis marker. It's all software based, so and it has been developed with the purpose that's directly correlated to our mission, which is the timely detection of patients with a hidden liver disease. We want to find the patients outside of specialist care and close that gap in the diagnostic field because that's where we see the big volume of patients that walks around without having an idea of them being or having fibrosis in their livers. The technology itself, just to touch on that very briefly, and Katrina hinted to it in the paper as well, is built upon a decade of or more of clinical research. And last year we got our CE certification, and that was a huge milestone because what that means is that we can clinically roll it out throughout Europe, so we can actually get this into the hands of physicians to impact the patients. And that's what we've been working on from the beginning, and that's the core of our mission. One thing I just want to touch upon with LiverPro, because there's a lot of different tests out there and more coming, which is really good for the field. Where LiverPro stands out is that it's a uniqueness and flexibility. So it's easy to scale and is highly compatible with different healthcare systems. And what that means is that we can ensure timely detection of patient during the first point of contact. So today, most of them need to go to specialist care before we actually figure out what's wrong with them. And what we wanted to change with LiverPro is moving that outside of specialist care. We use standard blood work. So we use blood work that's already sampled on at-risk patients. This could be doing a routine check of patients with type 2 diabetes. We don't need additional blood work, which is a key criteria when we also look at health economics. We are adaptable in the terms of number of inputs that we need. So it's not a fixed number. We can adapt for missing lab values. And again, that's also a quite unique and really relevant criteria because what we see when we look across healthcare systems is that it's not the same variables that are being analyzed on these patients. Even within the same region of clinics, it might be different values they're already taking on these patients. And we can adapt for that and still make sure that we do an accurate risk stratification at that consultation where the at-risk patients is already being seen. And the last point maybe to point out is that we are a backend solution, which means that we integrate in the healthcare infrastructure. And that means that we don't need to go clinic by clinic in installing a new application or a new system that we need to train people in. What we do is integrating it further centrally, which means that the physicians get these results as any other biochemical test result, any other lab result that are going into the patient health record. And that's, as we see it, really key to achieve this early detection outside of specialist care.
Is it 9 biomarkers that you use? Yeah. That's what it's total.
So 3 to 9 biomarkers is what we need. And what we see is that the majority is I mean, in plus 90% of the cases already there. And that is key with LiverPro, to have that flexibility, so we don't need to put in new biomarkers, do more blood testing. Everything that cost is a barrier to actually implement these solutions outside of specialist care.
Okay, so the first question that people will probably ask, so I'm going to ask on their behalf, is how, I mean, there are a lot of biomarkers that are being commercialized, a lot of combination of different biomarkers that are being touted as being, this is the one. Why is yours better, less expensive, faster, easier? What is it that differentiates you from the others? Is that a fair question?
Yeah, it's a fair question.
Okay.
Read the paper. No, there's
this is for everybody who hasn't read the paper.
yeah. There's different elements. Of course, performance and accuracy is one part, and here we see a really strong performance in especially low prevalence populations. So it's a really valuable tool to screen patients in big volumes. That we don't see that many biomarkers doing that. Most of them have been developed for secondary care. So I think that's a key. And then the operational part. So using data that's already there means that we can actually proactively flag patients. And that's something new. A lot of the other markers in the field have their advantages, but some of them might have a bit more of a advanced combination of input variables with limits, or makes it more difficult to sample those test results.
Okay, so if the system is in place in a physician's office, or maybe even a hospital, if they had been there before, when they hit the button, they will get, based on whatever range that they put in, I guess, for the results, they're going to get a list of patients that need to be reached out to inform them that they may be at risk and should seek more advanced liver health assessment. Is that it? Yeah.
Yeah, you can see. Yeah, Katrine, I don't know if you want to comment.
Yeah, no, I mean, we very much see LiverPro as the first test in a sequential of others. So we are not the diagnostic solution per se, but we can help risk stratify, or flag, or whatever to call it, and say, okay, this patient have an increased risk of having liver fibrosis. We should follow up with a FibroScan or a ELF test or whatever second tier test the given setting prefers. Yeah.
Okay. And last question, I think today, from the human real world perspective, from the evaluations like this that you've done before, obviously you've done some already, what was the response from patients when they got that call and were not expecting that call?
Oh, that's a good question. So there's two paths that we're following right now in Evido. The first one is the clinical implementation. So the core of the mission, what we're discussing right here, we got our CE certification in March and are currently doing the rollout. We've done doing certification. I mean, it's a heavy burden in terms of documentation and showing the quality of a medical device. And here we seen some really good results on patients. How can I say that the risk stratification helps maintain the intervention, so actually move patients' motivation for doing something, and this is something that we see quite key and is super interested about, like that the liver risk stratification actually moves the needle for patients. We haven't been that close to, and we don't we can say, deal with the patient directly.
Directly, yeah.
We're working with the physicians, and in that sense, supporting them with having the right dialogue with patients. So looking forward to dive even more into that, Mike, and see how what the future will bring.
Well, information is very powerful, and I think that we've seen in the real world the things like the scans, when people have had the VCTEs and stuff, when they can see the images of the damage that's done to their liver and get actual quantitative numbers and stuff, that can make a difference in motivating, as you said, Taus, motivating people to act.
For sure.
Knowing that you have a disease doesn't mean that they're going to change the way that they're living, right? Lifestyle is going to be the cornerstone of improvement.
Yeah,
with medication. So, well,
Yeah.
thank you both so much. We got to do this before another 2 years, okay?
Yes.
So maybe
Yes.
maybe in the next few months, let me know how things are going, and happy to have another chat we can share with everybody.
Yeah, no, I mean, we are also very much looking forward to meet you also at EASL, where we will also share some big news. Looking forward to that. And we have a lot of things going on in Evido in the pipeline, looking into some really interesting projects, also looking at clinical trials. So yeah, we have a lot of things cooking, and looking forward to see you next.
We won't tell anybody, but do you want to share what the big news is going to be at all? Or
not yet, not yet.
I mean, there's a couple people watching this, but all right.
You'll see. Mike.
All right, keep us in suspense. All right, thank you so much. Thank you both.
Thank you so much for having us, Mike.
Thank you so much, Mike.